Today in series of Docplexus KOL interviews, we have with us Dr. Ake Ortqvist. He's a faculty at the Karolinska Institute. He's the former head of Department of Infectious Diseases. He's also head of the Department of Communicable Disease Control in Sweden. He's an authority in influenza and pneumococcal vaccinations. He has a special expertise on vaccination strategies in high-risk subjects such as people with diabetes. Thank you so much, Doctor, for this interview. So let's begin with the first question. What are the vaccines that you are studying on high-risk diabetes patients?
The vaccines we use in Sweden are mostly the regular traditional, we call them trivalent, that includes 3 types of influenza, and they are based on egg culture virus. But we are going to, as many countries, to use 4-valent, there's 4 types of influenza in them, and there are also other types of vaccine, recombinant vaccines, cell-cultured vaccines, and we hope in the future to have even more effective ones.
Okay, so you're also studying the effectiveness of these vaccines.
Yes.
So can you please elaborate a little findings on them?
Yes, we actually, each season, we week for week study the effectiveness by combining registers for vaccination, by registers for those who fall ill, and then we can estimate the vaccine effectiveness each week, how it's going, and if we can transmit that to the population and see if it's good or not that season.
All right, so moving on to the next one. How important it is for diabetic patients to get vaccinated for influenza?
I would say it's very important, and as many risk groups, diabetes patients have a higher risk for developing severe influenza and also to developing influenza that will cause a death. So it's very important.
So I would also like to know if you can discuss some of the important strategies for vaccination uptake in a country like India.
Well, it's difficult for me to say how you should do it in India, but I know it's difficult everywhere.
Right.
We try to say that the most important overall anywhere is that your doctor or maybe your nurse tells you how important it is to vaccinate every year, regularly. You can also use mass campaigns, advertising, television advertising, and kind of SMS reminders and so on. But I think the personal recommendation by your doctor is the most important.
So how does that work in Sweden?
Good and bad. It works quite good by the older population, those 65 or older. But younger patients with diabetes are very hard to reach. So not that good. We could be much better.
So can you please tell us about the vaccine that you're studying on? So is it effective for diabetes?
Yes, it is effective. It is not a vaccine that is effective for 100%, but at least 50% most season. It can reduce the risk for getting influenza overall. And if you get it despite vaccination, it will be not as severe. So it's effective in diabetes patients as in other high-risk groups.
All right. Okay. All right. Okay. So thank you for the interview. It was a pleasure having you here.
Thank you very much.